The prostate is a small, nearly round organ seated in the male lower pelvis. It is directly adjacent to the urinary bladder, over here, and to the rectum in a posterior position to it. Here we can locate the prostate, and we can also easily see it is placed behind the pubic bone. So for us in performing ultrasound, this means we have to tilt our transducer behind the pubic bone, caudally, as we will see afterwards. The prostate looks a little bit like a walnut, and it has about 3 different zones: a peripheral zone, a central zone, and a transition zone. Around the gland, which is also important for us in ultrasound, we find a clear capsule. This is consisting of a thin real capsule and a fibrous pseudocapsule. Let's recapitulate. The prostate is inferior to the urinary bladder, anterior to the rectum, posterior to the pubic bone, and superior to the perineal membrane over here. Knowing the anatomic position, we already can imagine the positions of the transducer when we want to image the prostate with ultrasound. As with every organ, we will scan the prostate in 2 planes. We need a transverse plane and a longitudinal view, and we will find the prostate gland inferior to the urinary bladder. So we place our transducer at the lower abdomen, but we need an acoustic window to depict the prostate, the urinary bladder. So as a precondition, our patient should have a filled bladder, otherwise colon gas is blocking our view. Our patient is lying in a supine position, and we use again our curved array transducer as usual. The prostate should show a smooth regular capsule and a nearly round shape. It should have a volume under 25 or up to 25 milliliters, and the transverse diameter should be less than 5 centimeters. The longitudinal diameter and the ventral dorsal diameter under 3 centimeters. For the transverse plane, we place the transducer shortly above the pubic bone in a transverse position, as we already learned for performing a scan of the urinary bladder. Note that we have to tilt the transducer caudally in order to get behind the pubic bone and direct the ultrasound beam into the direction of the peritoneum. Here, the position of our transducer in the lower abdomen, shortly above the pubic bone. So, in this picture, we can easily detect the urinary bladder, as we already know. This fluid-filled organ, which is displayed black in our ultrasound picture. And dorsally and inferior of the bladder, we can see this round organ, and this is the prostate, the organ we're searching for now. The urinary bladder and the prostate over here. Now we got a video clip of a transverse scan of the prostate. Again, the urinary bladder over here. And when we move our transducer caudally, we can depict the prostate over here with a smooth round capsule, homogeneous organ over here, a perfectly healthy prostate. We again take the transducer and put it onto the lower abdomen in a transverse suprapubic view. And the prostate is localized at the bottom of the urinary bladder. And you see, I have to tilt my transducer strongly behind the pubic bone again. Look at my transducer here. And here at the bottom of our bladder, I show you, we see this round or oval-shaped structure over here. This is the prostate in a transverse view. Important is to assess if the border between the urinary bladder and the prostate is intact, and to measure the size. We can measure the ventral dorsal diameter, which should be under 3 centimeters. Here we got 2.6 centimeters, which is normal. And the next diameter is the transverse one, which should be under 5 centimeters. We got 3.6 centimeters here, which is quite normal. So for the second plane, we need for scanning the prostate, we got the longitudinal suprapubic view. And in this case, we place the transducer, again, shortly above the pubic bone in a longitudinal scan. Also, in this plane, we have to tilt the transducer behind the pubic bone in order to get a view of the prostate. And as you can see, we already know the urinary bladder, this time in a triangular shape. So we know we are in the longitudinal plane. And here, caudally, inferior to the bladder, we can see this round organ over here, which is a prostate in a longitudinal scan. Urinary bladder over here, and the prostate. So here in the video clip, again, of course, we perform a scan through the whole organ from side to side, easily to detect a reasonably filled urinary bladder and a healthy prostate in a longitudinal scan. We turn the transducer into the longitudinal position. And again, as you see, we have to tilt the transducer strongly downwards behind the pubic bone. And again, at the bottom of the urinary bladder, over here, we can see the prostate and can take the craniocaudal diameter, which should be under 3 centimeters and is 2.8 centimeters, means this is a normal prostate. We can also calculate the volume of the prostate. We already know how to do it. It's our formula diameter A multiplied by diameter B multiplied by diameter C divided by 2. And this volume of the prostate should be under 25 milliliters. We proceed to the pathologies of the prostate. And we start with the benign prostatic hyperplasia. Benign prostatic hyperplasia is a very common condition. About 50% of men by age 60 have hyperplasia of the prostate. And at age 90, the prevalence increases up to 90%. It is a proliferation of normal prostatic cells in the central or the transitional zone of the prostate. We find enlargement of the gland that can lead to compression of the urethra. There are typical symptoms in patients that show up with benign prostatic hyperplasia. They often observe a decrease of the urinary stream and a need to strain so that they can initiate to maintain urination. Often the frequency, the need to urinate, is increasing and the patients experience urinary urgency, which is a sudden urgent need to urinate with a sensation of imminent loss of urine. Often the patients find it difficult to initiate the process of urination. The stream is weakening and interrupting. The feeling of a non-completely really empty bladder after urination is also common and points to possible residual urine. In transabdominal ultrasound, we find an enlarged prostatic gland and we remember the measurements 5 versus 3 centimeters. The transverse diameter can be up to 5 centimeters, the other two up to 3 centimeters. And the complete volume should not exceed 25 milliliters. Important is that the bladder wall should be clearly distinguishable. When we find an enlarged prostate, it is useful also to measure the residual urine. We ask the patient to void after our first examination and measure the amount of fluid remaining in the bladder. Remember, up to 50 milliliters is normal, over 100 milliliters is significant residual urine, and in between there is a gray zone that can be a hint for a urinary disorder. And a urologic counsel is helpful in this case, and also, of course, if there's significant amount of urine. An enlarged prostate can be a cause for urinary retention and can subsequently also cause hydronephrosis. So remember, a filled urinary bladder with no urge to void may be an enlarged prostate. You should also take a look at the kidneys if you didn't do this already during your complete scan. When detecting a hypertrophic prostate, I always ask my patient if the condition is already known and if he has a regular checkup at his urologist. If that's not the case, I send him to a urologic checkup. Here in this first picture, we got an example of an enlarged prostate. You can see the transverse diameter. It's a little bit more than 5 centimeters. And here we got the ventral dorsal diameter, which exceeds the 3 centimeters. It is 3.8. So we got an enlarged prostate over here. Also, in the next picture, here again, the urinary bladder, reasonable field, and an enlarged prostate over here. But we still got clear borders to the urinary bladder. The same patient in a longitudinal scan, also in the longitudinal, in the cranial caudal diameter, we got an enlarged prostate over here. So important is to remember that when you encounter a patient with a hypertrophic prostate, we always ask them if the condition is already known and if they have a regular checkup at the urologist. If that's not the case, we send them to a urologic checkup. This is very important because in our next chapter, we go on with the prostatic carcinoma. And this is a disease which is often silent for a long time, and so early detection is very important. The prostatic carcinoma is the most common malignant tumor of men. The likelihood to get prostatic cancer increases with age. It's uncommon in men younger than 50 years and rarely diagnosed in men younger than 40 years of age. The prostatic carcinoma often shows no early clinical signs, and it is often identified in asymptomatic patients, for example, in a urologic routine checkup or an incidental pathologic finding when tissue is removed in transurethral resection of an initially benign prostatic hyperplasia. In later stages, symptoms like hematuria, urinary disorders, like, for example, urinary urgency and difficulties can occur. Also, lower back pain can be a symptom of the prostatic carcinoma. Advanced cases can show up even with bone pain due to metastasis, show up with anemia, weight loss, and the feeling of weakness. The prostatic carcinoma in ultrasound is usually a hypoechoic, inhomogeneous lesion, but it can also be hypo or even isoechoic. It is found mostly in the peripheral zone of the gland. The most important thing is that any lesion in the area of the prostatic needs further urologic diagnostics. But let's take a look of a suspicioned prostatic feature over here, prostatic lesion. So in this clip, we can see the urinary bladder over here, an enlarged prostate over here. And as you can see, it is really inhomogeneous, and we got no clear border to the urinary bladder. So this is highly suspicious for prostate carcinoma and needs a further urologic checkup. Here's the same patient, now this time his prostate in a transverse scan. When I stop the video over here, we can easily see the urinary bladder and this enlarged prostate, inhomogeneous, over here, calcifications, and I want to show you this feature at the end of our video. So the bladder wall is not clearly distinguishable anymore. So this is highly suspicious for a prostatic carcinoma. So the most important thing for us who perform abdominal ultrasound is that any lesion in the area of the prostate needs further urologic diagnostics. And all patients with benign prostatic hyperplasia should undergo their routine checkups at the urologists.